Welcome back. As we said earlier on, today in our episode, we'll have an interview with Professor Mohammed Sharif, who is an expert or is specialized quite specifically in immunology. Today we'll be talking mostly about immune system and how a quite wide definition of it. And especially, as we said earlier, in this particular point, or in these nowadays, as we're facing many families, unfortunately, are kind of worried. And we would like to be more knowledgeable and more informed about how is it that our immune system works and how to make it stronger. It's quite an important point where I think a lot of us would need to observe and learn from it. First, thank you very, very much, Dr. Mohammed, for being with us. It's a pleasure having you with us.
Thank you.
Now, before we go deep into anything, let us just first take it step by step.
Yes.
What is immune system?
Yes.
What is it? Just to give our brothers and sisters a quick insight. When we say immune system, what is it?
Yes. The immune system is a very big story. It may be a love story or a bad story. If it is a love story, it means the immunity.
Yes.
The defense of the body against invaders.
Yes.
Against foreigners, against organisms, against bacteria, virus, and everything, and how it can destroy these invaders.
Yes.
But if it is a bad story, the immune system can be exaggerated, can be act against the own body system and cause autoimmune diseases or some sorts of allergy, which we complain from a very big amount of allergens in our atmosphere.
Yes.
Our atmosphere is polluted by many allergens. Allergens means the substance which can evoke an allergy.
Yes.
Which can turn the immune system from good system to bad system.
Yes.
Now we are talking about the good view of the immune system. The immune system is classified according to two groups. The natural, which is a gift from Allah,
Subhanallah,
and an acquired.
Yes.
The natural or the innate immunity is an immunity against many invaders without an effort done by the body. As the skin, our skin, if the skin is intact, no invaders can go in because it is many layers.
Yes.
Allah get the skin many layers. There is a substance go from the skins, which is the sweat.
Yes.
The sweat is acidic and it can kill all invaders. The skin contains bacteria, which is benefit to us. This bacteria is called the flora, or the friends of the skin, or the friends of the body, which overcome the pathogens action. This is one type of the immunity, which is the innate or the natural immunity.
Yes.
Many other substances, as saliva, as
are all considered immunity also.
Yes, yes.
Okay.
But it is not against specific invaders. Any types of invaders.
Because this would follow the next question that I was about to ask, Doctor. In this case, since we now know that the immunity, what is the difference between immunization and vaccination then?
Immunization is the result of vaccination. When we vaccinate anybody, this means we introduce some bacteria, some viruses, some fungus in his body, and the body will react against these things and become immunized. Therefore, immunization is a result
of vaccination. Okay, then speaking of vaccination, what is in vaccines? I mean, what is in the vaccines that makes it so strong in that case?
In vaccine is bacteria.
Yes.
For example, we will speak about bacteria.
Yes.
Bacteria, when we use a vaccine, we must kill it.
Yes.
Because if we didn't kill it, it can cause a disease.
Of course.
We can decrease its virulence, its power to produce the disease.
Yes.
This is called attenuation. Therefore, the vaccine is prepared from killed bacteria or
Yes.
attenuated or low virulent bacteria.
Yes.
Sometimes we cannot get the attenuated bacteria
Yes.
or killed bacteria. Both are nothing for immunization. Therefore, we can do an engineering type of preparations.
Yes.
We take the virulent part of the organism, put it in non-pathogenic organisms, and we inject these non-pathogenic organisms in the body, and the
Yes.
body can form the immune response
to the appropriate bacteria.
and the appropriate gene,
Yes.
which can cause the disease.
Yes.
Okay. If we turn to virus, we can prepare the vaccine from viruses also by inactivating the virus.
Yes.
Or we attenuate the virus, or we can recombinant the virus.
Yes.
Recombinant virus, for example, a very important vaccine against hepatitis B virus.
Yes,
We
yes.
take the part which causes the disease and put it in yeast or flora bacteria which
Yes.
cannot cause disease, and we inject these bacteria inside
Back into the patient.
Yes.
Yes.
The bacteria can eliminate this factor to the body, and the
Yes.
body form the immunity against this virus.
Yeah, continuing, doctor, with your own question, since the vaccine or the vaccination comes from, sometimes, as you said by yourself, it comes from the virus itself, or from the virus, basically. Yes, right.
Yes.
Is it safe? I mean, vaccines in that case, are all the vaccines considered safe?
Of course, it must be safe.
Yes.
Because if it is not safe, it can cause the disease.
Okay, because that's why. Yes.
Yes, and there are some indications and contraindications of some vaccines.
Yes.
For example, if we vaccinate polio virus,
Yes.
the polio virus, the child must be not immune compromised.
Yes,
Immune
yes.
compromised.
But I would like to make it more obvious to our brothers and sisters.
Yes.
They need to know
Immune compromised means the immune system is depressed.
Yes.
For
many other reasons. The reason why it would be depressed.
Yes. If it is depressed, we cannot.
Not functioning as it should, in short. The immune system, when it doesn't function as it should.
Yes.
Yes, doctor.
This is one of the contraindications
Yes.
of vaccines. As we know that influenza virus
Yes.
Contains many genes.
Yes.
Contains many types,
Yes.
and every time it is in a continuous antigenic variation,
Yes.
either in a drift manner or shift manner. What this means? Drift manner, this means that the antigens or the genes in the influenza changed in a very minor type,
Yes.
one or two. But if it is shift, all the genes can be changed every now and then.
Yeah. It's quite complicated, I would
It is
presume, as a
quite
virus.
complicated. Yes, yes.
Doctor, how long does it take for the immunization to work?
It depends upon the vaccine.
It depends.
Yes, some vaccines can cause immunization after 1 week, after 2 months, after 1 year.
Yes.
And the response may be very short or moderate, or it may last
Yes.
all the time. This
Yes.
is called solid immunity.
Solid immunity.
Solid. As immunity against measles,
Yes.
against mumps,
Yes.
mumps,
Yes.
against polio, against smallpox.
Yes. Yes.
If you want to know how the vaccine it acts
Yes.
by stimulating one type of the immune response, either antibodies, which is called the immunoglobulins, or a special type of cells which is more powerful, and it is called cellular immunity.
Cellular.
Therefore, we have two types of acquired immunity,
Yes.
either by the formation of antibody, which is called the humoral, or the stimulation of cells, and it is called cellular.
Yes.
The cellular immunity is very apparent in the immunization against TB, which increased now.
Yes.
The incidence of TB increased now. If I have not a cellular immunity against TB, it will be very dangerous, because the antibody have nothing to do with TB. Because TB is not an organism which can circulate in your body, in the blood. It can go inside certain cells and be far from the immune system.
That is understood.
Yeah.
Doctor, I have a question also, and this is very related to families, brothers and sisters in the society, which is regarding, is everyone protected from a disease by immunization, or the immune system? Currently, as you know, that the period of time that we're in is a time where a lot of our families are worried.
Yeah.
Regarding this, what sort of precautions of vaccinations can be taken, for example, or should be considered?
Yeah, these are very good questions and professional questions.
Yeah.
The fetus or the baby in utero is not delivered.
Yes.
He takes the immunity against all the known diseases from his mother.
From his mother?
Yes.
Yes.
And after birth, it can take the antibodies also by lactation.
Yes.
And the Islamic religion say that you must give breast milk for your baby.
Yeah, of course, of course.
Okay. وفطامه في عامين.
صحيح.
Therefore, after 6 months, these antibodies were fed up slowly. And the child now needs to be immunized.
Yes, that is true.
There are a schedule of immunization. The DPT against diphtheria, whooping cough and tetanus, against poliomyelitis, against TB, against measles, against mumps.
Subhanallah, it's all in, it's a package.
Yes, it is a package. But don't give a load on the immune system.
Yes.
If the immune system facing a load of antigens or a load of vaccines, it can stop. Okay?
It can, yes.
Therefore, there is a schedule for each disease and the time of each vaccine.
Okay, that is wonderful. But continuing on this particular topic, as you said, which is also regarding children.
Yeah.
Why in this particular case, since subhanallah, Allah has, as you said, regarding breastfeeding, it's a package of so many, I don't know to say whether vaccines, but it's natural.
Yes.
Then why is it that children get so many immunization and are focused on vaccines? Shouldn't they get it naturally?
It can be taken naturally through his mother. But because the mother contains antibodies of her own proteins, these proteins is foreign to the baby.
Yes.
And the baby get rid of these antibodies after 6 months and is now not immunized. The other thing is the exposure of the child to a very small doses of the organism, which can stimulate the immune system to form antibodies.
Yes.
For example, poor peoples which they have children playing in the earth,
street,
they are immunized.
Yes, I was just going to ask about, because so many parents and so many mothers don't really like their children playing outside at home, even touching dusty things.
Yes.
I would just like to verify, because I myself am not sure, as not being a professional. Is it true that allowing your child to some extent interacting with the environment naturally, the earth, is it good or is it wrong, as many mothers fear?
Oh yes, actually it is good and wrong in the same
time. Yes.
Because if the child exposed to a large dose of the antigen can get the disease.
Yes.
But for example, our air, we are polluted with TB,
yes,
with the disease,
yes,
which causes tuberculosis, but in a very small dose, which can stimulate the immune system, and the child become completely immune against this.
Because there's so many mothers who refuse sometimes, because I would like to ask, in a case where some children sometimes would have weak immune systems, I'm not sure, and doctor, please help me if I'm wrong.
Yeah.
Is it related that during the early time, or the early age, or the early period of the child's life, that child was not really exposed to the natural environment, to be more exposed to different bacteria, so that he or she could create the immunization system?
Yes, but it's very dangerous, because it may be, the dose may be large, number one.
Then how should it be controlled?
Number two, the child, we have a wide range.
Yes.
Okay, extreme of age.
Yes.
The child and old age. Yes. Old age like me.
No.
The immune system here and there is depressed. Therefore, we must take care of these two extreme ages.
Okay.
Exposure of the organisms in the normal pollution is not bad, but we can't judge if the organism's presence in a very small dose or large dose. Yes. Nobody can know.
Yes. There is another question that many mothers have been focusing on, especially with their infants. Yeah. They're worried in general that since the child is given so many vaccination in the early stages of their life, can this overwhelm the child's immune system, suppressing it in the future so that it doesn't function correctly?
No. If they take a lot of vaccines in a schedule, in a specific time,
there
is no bad effect on the immune system at all.
That would not have an effect, not even in the future.
Yeah, but they must remember in the future, as you said, they must take a booster doses every now and then, a booster doses to stimulate, to remember the immune system by
to
this
remind it to
organism.
move. Yes.
Yeah.
But okay, this would take me to so many things. I mean, is that why we see so many children being immunized by different corporations, by the government? The reason why this is the reason why so many corporations and governments insist on vaccinating children.
Yes.
This worries mothers that this is too much at one point, because, as you said, you need to follow a schedule that is repetitive.
Yeah.
That's why they're very, very worried. If you can talk about this to put mothers in ease, that this is not something to be worried about.
Yes. Actually, the Ministry of Health must give a memo or a report on every child. This child must take the vaccine so and so in time so and so. The schedule is very important. And by the way, it must be compulsory. Some diseases and some vaccines must be compulsory.
Really?
Yes, compulsory by the law. If the patient didn't take,
must be obligated.
Yes, we are eradicated now. The poliomyelitis is eradicated from Egypt
Alhamdulillah,
now. Alhamdulillah. Therefore, this is because it is compulsory.
Yes. Okay. Just to know, are there any side effects or side effects of immunizations?
Yes, of course.
There are.
Some vaccines can cause serious diseases, as measles vaccines can cause encephalitis, inflammation of the brain cells.
That is.
But this occurs in some children under certain conditions, and the pediatrics know that, and he can avoid the vaccination of this child against this vaccine.
Yes. Okay. That is quite what. Okay, just one. Unfortunately, time is really not on our side, unfortunately. But there is a part I would like to talk about very quickly. What which is allergies. Allergies.
Yes.
What causes allergies in very brief form?
Yes, in very brief form, as I said before, immunity is due to antibodies.
Yes.
Antibodies, there are 5 types of antibodies,
Yes.
or immunoglobulins. One of them, if it is formed against certain foreign substance,
Yes.
it can stimulate the body to release a substance cause allergy, as histamine, leukotrienes. Histamine can cause vasodilatation and flushing,
Yes.
and may cause anaphylactic
Yes.
fatal manifestation,
Wow.
or it can cause bronchospasm and bronchial asthma, which is nowadays it is
Wow.
widespread.
Wow. And I would notice very quickly that newly born children now, or
Yes.
infants at this particular generation, are usually born with, I don't know how to say this, natural
Yes.
chest or breathing allergy.
Yeah, because the immune system is not adapted to these types of foreign substances.
Is that related to the mother while she has the baby?
Yeah, maybe.
Okay.
Because it can be transmitted hereditary.
Okay.
Hereditary from the certain families are characterized by bronchospasm
Yes.
and
Yes.
bronchial asthma.
Yes, of course.
Yeah.
Okay, well, that's thank you very, very much.
Not at all.
I've really benefited because this particular point, has taken my attention. Because when we talk about allergies, I mean, to be honest, what is the most common allergy we'd find, especially in children?
Allergens which cause allergy may be inhalers, maybe food,
Yes.
maybe some dyes, some
Yes.
Fabrics,
Yes.
many things. But actually, the most important is the inhalers.
Yes.
Pollens during spring
Yes,
time.
of course.
The pollens, the hair dunders. By the way, the cat is very dangerous to cause bronchial asthma because the dunders.
Yes.
The dunders of the can cause
For children.
Yes, yes, very dangerous. Yeah. Domestic animals as a whole, but the cat.
Yes. Then what would be your advice towards providing or developing a better protection against allergies?
Yes, against chest.
Yes,
means
especially.
Especially chest. If the allergy is continuous in the family,
Yes.
you must get rid of all the domestic animals.
Yes.
You must
Cats.
clean. This is very important.
Because I love cats, that's why I'm asking.
You must clean the what's called the
Area where it lives and
yes, because if you pack the clothes of winter,
yes.
a small insects called mites.
Yes.
Mites can live in this one, and when you get it in the next winter,
Yes.
the mites
Yes.
spread in
the air and everywhere.
and they can cause severe
then what
allergy.
is your advice to improve the immune system in general?
To improve the immune system, it can be improved by many ways.
Yes.
Number one, nutrition.
Nutrition.
Yes. Number two, psychiatric. If you are
Yes.
in a good,
That is,
you know
of
what
course.
I mean.
Yes, of course, especially in nutrition.
Yes.
Well,
yes.
thank you very, very much.
Not at all.
Thank you very, very much, Doctor. It was a pleasure having you.
Thank you.
Really, we've benefited a lot. I have learned a lot. Thank you very much.